Welcome back to Your View.
Thanks for staying with us. Everything we do, say, or think is controlled by our brain. So when our brain is injured, it has the potential to affect every aspect of our life. According to United Nations report, nearly 1 in 6 of the world's population suffer from neurological disorders. Joining us on the show is a general practitioner who is also the executive director and founder of Brain and Body Foundation, Dr. David Ajibade. Welcome to the show, sir.
Thank you.
You can call us on 0708066814. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read your tweets. We're going to get into proper neurological disorders, but we were talking earlier about kids and phones. Do you think it's dangerous to have children use phones early, especially mobile phones?
Actually, left to me, I would say children should not put a phone to the ear at all between the ages earlier than 8 years of age, really, because and your discussion, as I was listening intently, there are really good points. But the fact is, the WHO has come up with a decree that brain cancer can be caused by mobile phones. I mean, they've categorically stated that, and that's because the radiation that you mentioned actually penetrate the brain, of course. The skull is thicker in adults, so we have more resilience. We can still be affected by brain cancer because of the radiation. It's much worse in children because their skulls aren't solid enough, they're not well formed. So for starters, that would be a big no-no. I would say if at all they're going to use phones, they need to have train them to use a speaker or to have a wire.
Can I ask you this question?
Sure.
Because my mobile phone is a smartphone, and when I put it, it gets really hot, so I don't use it. But I noticed that I also have a pure water phone. Even if I'm talking on that phone for 1 hour, it doesn't get hot. So do you think that those have radiation?
The pure water phone, I'm assuming that's
the small,
basic
non-smartphone.
Those still emit radio waves, but of course the smartphones, because of the Wi-Fi, because they are bouncing off, radiation is bouncing off cell phone towers and all those things, is much, much, much worse. And another thing about that is that when the batteries are going down, they seem to emit a lot more radiation. So again, there's
you don't use your phones when the batteries are going down. Okay, let's move over to neurological disorder, because I have an uncle who passed on a few years ago. Great guy, no issues, no illness, hardly goes to the hospital, nothing wrong with him, and suddenly he had a brain tumor. They found a lump somewhere, and things began to deteriorate from that. There were no symptoms. We didn't know what was going on. Suddenly he just got dizzy, and they found a tumor. How does that happen, where people are diagnosed with a tumor in the brain, even without any symptoms?
How old was he?
He was, I think it was late 50s, almost maybe about early 60s, maybe about 59, 60.
It's still a mystery as to how cancer occurs across the board. What we know is that, and I'm not an oncologist, but what we know is that continual irritation, inflammation, stimulation, toxins in the brain, other parts of the body, can eventually tilt the brain cells into being transformed into cancer cells. So what exactly happened in this man's case, we may not know. There could be a genetic factor involved. There could be some toxins he was exposed to. There could be some weakness here or there, something that he was constantly being exposed to, and that eventually turns it into a cancer cell.
So most people watching probably wouldn't understand what a neurological disorder is.
Yeah.
I didn't. I had to Google it. So can you just break down what exactly what is neurological disorder all about, and what are examples of how it plays out in the body?
Sure. Well, neurological disorders are primarily disorders of the brain. So you have the neurologist who deals with disorders of the brain, and you have the psychiatrist who deals with disorders primarily of the mind. Okay, so a neurological disorder is when the brain cells or the tissues in the brain kind of like go wrong. So a perfect example would be Alzheimer's disease, dementia, Parkinson's disease. In the children's age group, autism, cerebral palsy, what's the other one? Seizure disorders. The key thing, in my opinion, whether it's a psychiatric conditions, obviously, are schizophrenia, depression, mania, It doesn't matter whether it's a neurological condition or a psychiatric condition. The bottom line is that somehow, the brain cells, the brain tissue is not working like it should. Now, we have developed tremendous technology and equipment to really detect the brain problems, but there are still many issues, especially in the psychiatric area, that you can't really tell by looking at an MRI or CT scan. However, they're there, and they're developing even greater and greater ways to look at them. But bottom line is that there's something wrong, physically something wrong with the brain tissue.
Right.
And if you can, and so one of the approaches that we're looking at too is not just treating with medication,
Right.
which has been proven to be effective, in some cases not so effective, but looking at how to nourish and rebuild, put those building blocks back into the brain.
Can
So
I
here,
Oh,
okay, let me go. So I'm listening to you and I'm wondering, do I just have like an appointment with a doctor every 3 months just to go and check and make sure that there's nothing in my brain? What do I do to make sure I do not get a disorder? What do I do
With my
to
kids,
prevent
in
it
prevention.
with my kids? You know, sometimes you hear somebody hit somebody on the head with a ball and then
That's it.
things just, so what do we do?
I think that's why brain literacy and brain education and awareness is so important, because there's so much that we don't know. I'm talking about the general public now, about how our brains work, the toxins, the things that can affect it for better or for worse. So it's really important that people begin to understand this, especially in Nigerians and Africans as a whole, because from what we've seen, we do have some, shall we say, disadvantages when it comes to brain disorders. For one, we have higher rates of these psychiatric conditions. Epilepsies are very big in Nigeria and in sub-Saharan Africa. So, and then of course, what we saw with our foundation, when we're looking at dealing with kids, is that many times pregnant women don't really realize what they're doing to their bodies. They take in things, or they have an infection, and they're like, it's not a big deal. We just pass it over. And the next thing, that you come out with a child that actually we've seen parts of the brain actually being missing, because the woman just had a slight infection. She didn't take it seriously. She didn't go to the
So
doctor.
like, sorry, like what sort of infection would she have?
Yeah, I need you to
Like
finish
what
that.
kind of infection would
They were querying a viral infection, and they weren't sure what it was. Again, that's the problem we have. We're not really able to really detect and diagnose.
I think pregnant women shouldn't take
Antibiotics.
painkillers as well. Because I noticed in this part of the world, a lot of women abuse their pregnancies by taking in painkillers, antibiotics. They just, this self-medication.
Yeah.
I mean, I was so bad I didn't even take my iron tablets because I just refused anything. I just didn't want anything chemical in my body. But I was going to ask you, what is bipolar?
Bipolar depression is, as the name implies, there are two ranges. In some aspects of the depression, sometimes it's very mild and just very quiet and timid, let's put it. In other extremes, the same person could become manic, tearing things up, screaming, shouting, making a mess. So it's a person who swings from one end of the spectrum to the other.
Okay, let me go back to the issue of pregnant women, because when women give birth to autistic children, they tend to blame themselves. Was this something I did? What happened? What went wrong? Are you suggesting that these could be things caused by maybe something she took in, something that she didn't pay attention to, a diet, or something she did that might have caused this thing? Has it been proven that actually it could have been preventable for a child to come out as autistic?
There's a whole range of things that cause autism. And certainly we don't want mothers to start feeling guilty about what they did or didn't do. In fact, in some cases, the father too they found a correlation between older age groups of the father and autism. I would like to flip it by saying that there are things that we should be doing to really strengthen our brains, and then of course strengthen the possibility of having a child that is very healthy.
Thank you very much. You know why I say thank you very much? Because you see me, the age I am now, I am at the risk of, what are all those things? Those dementia, Alzheimer's, all those things. So just in case, what can I do to prevent it now?
The general, and that's a great question. Some of the general suggestions that are out there is you have to sleep better. They found that a lot of sleep, not having enough sleep, proper sleep now. When I say proper sleep, lights out, nothing,
I
no
have to pause
sound.
you for a second
No
because
interruption.
YK actually asked a very vital question. There are lots of people that actually need this information, but I don't want to cut you off. So let's go on a quick break. When we come back, we get the full answer of this question. Stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So before we went to the break, Mike had asked the question concerning especially people who are getting into that senior range, dementia issues, schizophrenia, Alzheimer's, Parkinson's, and she's asking what are those things that she can start doing now to prevent those things from happening?
Mm-hmm. Yeah, so we're talking about sleep, very important sleep. Exercise, you need to move around. What they say is that if you strengthen the brain, if you keep doing the things that help the brain work better, so they advocate learning new things,
Crossword
reading,
puzzles.
crossword puzzles, exercising your brain, very, very important. You would take things that have been proven to help to nourish and build the brain back up. So obviously one of the things that people don't talk about much, which I think they should, is vitamin D3.
Oh,
Vitamin D3.
It's very important for the brain. You also need to take omega-3, a very good omega-3 fatty acids, a very good supplement that has omega-3 fatty acids. And I think we have not done enough justice as brain researchers to really explain why this is so important. Because the brain is made up, if you take out all the water, 60% of what is left of the dry brain is made up of fats. And omega-3s play a huge role in composing, in being a part of that. So I think everybody should, right from age of 30, because that's when you plateau and you begin to slowly go downhill. So I think...
and all of us are above 30.
Yes. So omega-3, is that from...
Yeah, I even read
That's the fat
The
from...
natural sources.
Yes,
fish,
is
right?
it from fish or is it natural source or is it supplements? Which
There
is
are
best?
two problems with that, with just from taking fish. One, you don't get enough of the right dose. It's not nearly high enough. And two, you have toxins in fish.
Right.
So I prefer to take from a very high grade, high purified.
Okay, so when you talk about, we've discussed the older people,
White kids
but
people.
there are people that are young or people that are in
Kids.
childbearing age or people that are raising children. And we know that some of these things are sort of preventable from when you're young. So now you've confirmed to us that radiation can make children have brain disorders, right? If they get exposed to it before 8. Can you tell us other things that we're doing, that we're exposing ourselves to as mothers and our children
Or
or
exposing our
food?
children to.
What are the things we're exposing ourselves to that can predispose us towards these disorders?
Well, one thing I'd like to talk about, and that's a great question, and probably not enough time to talk about all the different things, but one of the things I'd like to point out to the most, because it's easy to do, I think we're just lazy about doing it, is your regular teeth brushing.
Yeah.
And not just teeth brushing, but flossing as well. People don't realize that there's a strong correlation between dental hygiene and brain disorders, but not only brain disorders, heart disease, premature abortions, miscarriages.
From not brushing your teeth.
From
I don't get it.
brushing your teeth.
If you don't brush your teeth.
Tell us how.
My house, we only do once a day.
I do
brushing.
2-3 times a day, but I just want to know
2,
why
3.
and
My
how.
husband is the only one that brushes twice. I brush once a day. My kids don't. I mean, my kids have been pushing me to make them brush at night, but I'm too lazy to even
My
get them to
husband
brush at
does
night.
the brushing, the
Why
flossing.
Why is that so
the-
important though?
Well, gingivitis, which is inflammation or infection of the
Gum.
gums, good. If your teeth are not clean like they should, they harbor what? Bacteria.
Bacteria,
Especially between the crevices and all that. What they found out is that those bacteria find their way into the
travel up.
bloodstream, into the brain,
Wow.
and they begin to form deposits, and they act as focal points for toxins and plaques and, in fact, form atherosclerosis. If you have atherosclerosis, it can affect the brain too, obviously, because blood flow is so important. The blood carries nutrients, it carries oxygen.
Wow.
If you're not having enough oxygen because of blockage of
Okay,
the
how can I flush it out, please, if it has gone up there? Is there a way to flush them out?
It's gone.
Is it too
And
late?
it has affected Mariah Augustin. She doesn't clean her teeth.
What is great about the human body, and I love it, is that the human body has the capacity. Once you give it the right tools, once you put it in the right environment, it is able to reverse things. So it's never too late to begin to do the right thing.
Can you give us a few power brain
So
food?
if I start brushing my teeth at night now, morning and night, I'll be all right.
might help.
Then
might
take
help.
omega-3 and
Omega-3, vitamin
crossword
D3.
puzzles.
No, it's working that this crossover.
Oh,
It's not
okay.
me yet. It's not-
But like, what are the densely rich,
They say from
nutrient-based
30.
food that we can just start loading ourselves with, load our kids with to boost our brain?
Right.
Great.
Fantastic question.
You ask great questions on this show. Love it. So obviously, you can't go wrong with fruits and vegetables, avocados. I mean, and when we talk about vegetables, and again, when I mention things in public, I'm like, ugh, because it's sometimes so difficult to buy these things, to purchase these things. But we have to say that
great.
avocados are great. Of course, the lemons and the carrots, all these legumes, these are very, very important. You want to stay away from things like processed foods, cornflakes, even fried foods, because
Bread.
yes.
You eat cornflakes, you. But you don't stop cornflakes now.
You want to reduce these things because another thing you want to avoid is too much sugar.
Yes,
and what we know is that cornflakes and other things like that. I'm not going to mention any kind of noodles, but they put a lot of carbohydrates in your system, and this can.
Okay, let me quickly take this call from Lekon. Do we have some tweets, YK? Lekon, are you there?
Yes, good morning.
Very quickly, please go ahead.
Hello?
We can hear you live. Go ahead, please.
All right. I want to commend the doctor
Right.
on the show. Yeah, I can hear me.
We can hear you.
Yeah, I'd like to commend you guys and commend the doctor on the show. You guys in the medical area, specialized medical area like the neurological thing, are really, really doing a fantastic job. Considering the medical deficit that we have in a country like Nigeria. Just about 2 or 3 days ago, I was talking to a friend, and it was obviously really sad. And I asked him what happened. I now told him that one of his neighbors that I saw about 2 or 3 days ago, very active, alive, and all that, was just complaining of a headache. And immediately the guy slumped and he died.
Whoa.
And to be honest with you, I've seen issues around that situation a lot of time, which you can further, enlighten the Nigerian public about the issue of brain aneurysm.
Thank you very much, Lekon. Let me cut you off there because what are the symptoms you can notice just to suggest that you may have a disorder? Because I think that's what he was saying. Somebody slumped. You could have been, we heard of high blood pressure and all that. But in your own field, are there things we can notice to show that, okay, there's something going on here, I need to get it checked?
Yeah, just a quick point. Many things, by the time you start noticing symptoms, this thing has been must have gone on 10, 20 years because the brain is very resilient, but very sensitive too. Some of the things you might notice, memory loss. You just can't. It's natural to forget where you kept your keys, but when you put your keys in the fridge and you go back to the
That's
fridge,
like all of us.
and you say,
You put your keys in the fridge?
No, I mean, we
No, but
forget
I
things.
forget things. I definitely forget things a lot.
Forgetful.
And so if you're under stress, just know that if you're under stress for a long period of time, you know that your brain is already being compromised. I mean, you don't even have to have any symptoms. I remember all the time when I was under a lot of stress at one point in time.
That means we're all compromised in Nigeria.
Okay, yes.
That's why
because
we need sleep. Sleep
I was
is
going
very,
to
very
say,
Let me
a
take some
little
tweets
thing-
because we have very little time left. Go into it.
Yeah, I was going to take tweets, but gosh, I wanted to ask you.
Ayode,
My question here is, this is Prince Ernest. What is the perfect time to sleep?
Best times between 10 o'clock and 3 o'clock. That's when the body repairs and does the best of its fixing. So 10 between
So
10
sleep
and
before
3.
10 and make sure you wake up after 3. So between 10 and 3, make sure you're sleeping at that time because your brain is fixing. Oh, yeah.
How about those of us that like clubbing?
Ayodeji says, it depends on the type of phone and the age of the child. It's not a bad idea. Andrew Instream said, I said this to Muriah last year. Eating processed food encourages dementia faster. Exercise, sleep well, learn new things. Good word.
Onwara is asking, please, I have a question about epilepsy. Is it also a brain disorder and what can be done about it? I have a brother who has been battling epilepsy for 20 years and
Ooh, we have
we
just
thought it was
few
spiritual
seconds.
attack.
Few seconds. Could you quickly answer that?
He's been on Tegretol, but he still has attacks.
Yes, it is a brain disorder. You might have to go see another doctor to get the right mix of medications right for you. But again, like I mentioned, some brain foods can really be helpful. In our foundation, we found that we were able to help a lot of children with seizures just by giving them high dose omega-3s.
Yes,
So,
and I
proper
can
nutrition is
tell all of
important.
them
So
that
proper
the brain
nutrition.
actually starts to deteriorate from 30.
Really?
I
Don't
read
feel-
many years ago that the brain cells stop reproducing after 30.
So they say we
start-
should sleep and
We
be
have to
taking
run.
omega-3.
Unfortunately, I don't have any
We
more
will
time.
start taking
But they've,
omega-3.
they have told YK to be taking vitamin D3.
Help me tell them, you see, it's only YK they are
You don't have to be
saying.
doing puzzle.
Yes, crossword puzzle.
They have your brain.
Learn a
So
new
that you get
language.
them-
It's only YK they are seeing.
That's all
Doctor,
they can take.
tell them.
Unfortunately, tomorrow is our live audience show. Please
Yes,
come
sir.
early. When you have 36, come early so you can get a seat. And also, don't forget, please do not use unbranded oil. It's dangerous to your health. Have a fabulous day. We'll see you tomorrow.
Bye.
Doctor.